Good afternoon, America, the greatest country on earth where hope springs eternal. Today, we're going to talk about how to set up a resilience network and the importance of a resilience network. And we have some very special guests today. First up, I'd like to introduce Tracy Hollister. Tracy is a long time involved in the Make America Healthy Again movement. You could say she was Maha before Maha was cool. And she even worked on the RFK Jr. presidential campaign. So from Raleigh, North Carolina, please welcome Tracy Hollister. Also, we have a couple of guests that might be familiar to you in the life aid space. First up, she's a travel nurse. When she's home, she resides in Florida. And please welcome Arlene Augusto. And a new guest, but someone who's certainly familiar, especially to those of you in the LA area, U.S. Navy veteran Jordan Iserman. And last but not least, he just rejoined us. He is the recently retired, just 8 days, he's been retired as the Adjutant General from the Vermont National Guard. He also served as the chairman on the Joint Generals Task Force for Sexual Assault, Domestic Violence, and Suicide Prevention. Please welcome Greg Knight.
Sorry, folks, the phone overheated. I just can't win today.
Yeah, well, there's always that. Technology, life, it's all about resilience, right? So everybody in life deals with ups and downs. And the question is, do you give up or do you fight through it? And so with that, that's kind of our overall theme is resilience, and how do you go about setting up a network so that particularly the military, veteran, first responders, frontline healthcare workers, people who have high stress environments can find the kind of resources that can help them navigate those rough waters. So with that, I'm going to start with you, Tracy, kind of talk about some of the work that you do and some of your ideas on how we can set up resilience networks using AI.
Okay, great. Yeah, I'm in the process of planning a startup that'll be to connect people with health issues, chronic health issues, or who just want to be healthier with root cause practitioners. I've had the most interest recently with disillusioned alternative insurance brokers who have seen the worst in very expensive healthcare plans and dysfunctional medical systems. So the idea behind this business is doing, let me see, I'll call it TLC. So it starts with tell. So the person with the health issue will call in, tell us hours, hours of information about all the things that impact their health, their trauma as a child. It might be mold exposure. It might be war-related brain injuries. It might be all kinds of things. And then even vaccination injury. And then, so we would do like a thorough intake for a couple of hours. And then on the other side, we would have a directory of root cause health practitioners. These are the kind that dig long enough and deep enough for the answer. But what we'll do is we will have done some of their work ahead of time and prepared these people to bring 60% of the puzzle pieces to the table. And these people will do extra tests, and then they'll offer their nutritional advice, their lifestyle advice, infrared, hyperbaric, all these alternative treatments that help them with their condition and don't cover up the root cause with a drug. So it's basically a lot of other treatments other than drugs. And in the process of planning that, I've got a couple of Brownstone Institute talks coming up, and I'll be doing some focus groups and get it off the ground hopefully this year. So happy to answer any questions and looking forward to what you all have to say.
Yeah, that's very exciting. So Greg, as the Adjutant General of a state, you're responsible for the entire, not only Army National Guard, but also Air National Guard. And in a state like Vermont, where people are spread out, there's a lot of small communities or rural communities. What were some of the challenges that you guys had to service those National Guard personnel? What kind of systems did you have, and what kind of systems did you wish you had?
Well, thanks for the question, John. For us, the biggest challenge, and has been for any rural state, in fact, it was National Public Radio a few months ago, probably close to a year. They had a show on about healthcare deserts, focusing on active duty military. At no point did they discuss the Guard. If you talk about a healthcare desert, we're in the Mojave. We don't have, I mean, particularly when it comes to mental health, don't have enough providers. We don't have enough that are participating in TRICARE, accepting new patients. Very few that specialize in PTSD, adjustment disorders, all those things that are unique to military veterans and probably first responders as well. And that's probably one of the biggest frustrations for me, coming from National Guard Bureau. And look, they're all doing great work. But Tracy, I appreciate your initiative, because we need more innovation. And all the approaches I've seen right now are very traditional, kind of stovepiped and being force fed to the field, as opposed to the bottom up solution that we're looking for. I'll give you as an example. I talked with John about it yesterday. We had actually bought the machine for subdural stimulation, and SF was using it. The special operations folks were using it to great success. And we tried to, and we couldn't get through a contract with Uniformed Services Health University to do the analysis. We had people trained, ready to go. It had been proven. And unfortunately, the way it was written, they considered it human experimentation. They wouldn't touch it. So it's immensely frustrating for us out here in the field to know we've got a problem and really not having a way to fix it. You can show me Lucky Charm slides, we're red, we're amber, we're green, and all these initiatives, but what is actually getting to the field remains immensely frustrating, I think, for most adjutant generals.
Yeah, and so I want to pivot now to the VA. So this is a question for Arlene and Jordan. As veterans, you have your choice of working within your local assigned VA hospital or medical center or clinic, or you can also opt through what they now call VA Choice, where you can opt into community care. So let's talk about how that affects you, Arlene. Especially, I'll let you go first because you're a travel nurse, so you also get to see from the private providers network. Kind of talk about, like, where are the gaps and how can we fix it, or how can we make it better?
One thing about community care, it has its bumps. When it comes to mental health, I was seeing a community care provider, and I had great outcomes, but then they stopped the funding. And now the only way I can see a provider that works for me is to pay out of pocket or to utilize my insurance. So when it comes to mental health, community care is an obstacle, and that's an issue.
Is that because of VA bureaucracy, or because community care partners aren't available?
No, I have a provider that is available that will take the VA, but the VA doesn't want to pay for it. But the same thing, I just went through a situation where for dental care, I needed an implant for dental care, and my community, I go see dental in the community, and the issue that we have with dental in the community is the providers will take it. They send their information to the VA, but the people at the VA don't upload the information to get to the dentist to get approved. So it's like a process that's not working. And it's, you have to, as you know, I have a big mouth. So as soon as my provider sends it to the VA, I give them a month. If they don't upload it, I call the VA White House hotline. I let them know what the problem is. And usually I'll get the problem was fixed when it wasn't. So then I call the VA hotline again and say the problem wasn't fixed. We still have the problem. And then by then it gets fixed. But not every veteran is going to do that. Not every veteran knows.
Exactly. They don't know.
They give up, you know.
Wow. That's
So,
crazy.
so and I don't know what's going to happen once other administrations get in charge, if that VA hotline is going to go away. Because that was started with the first Trump administration that we got that. And then when, and I don't want to get political, but when Biden came in, it changed and it got worse. So, and now it's kind of in the middle right now, the way it works. But we shouldn't, as veterans, we shouldn't have to wait 6 or 7 months for somebody to upload the treatment plan that was established. It shouldn't be that long.
Well, no, I
No.
mean, it's 2026. I mean, we have technology now, and it should happen like right away. And so, Jordan, kind of talk about your experience and what you've experienced. I mean, the West LA VA has a good reputation for care. So kind of talk about what your situation, that you live in what we would consider a rural area, I would think.
Mm-hmm. Lancaster just had a clinic open, a community clinic, so that's kind of a good thing. But I'll be honest with you, I don't use that. I use the Sepulveda clinic, which I still would rather drive an hour to my doctor because she's really good. But I will give you 3 primary care things. When I started using the VA, I had hearing problems. So I actually went to a hearing appointment at the contract clinic in Lancaster. I had a really nasty audiologist that told me that a crossover hearing aid would not work for me. So he gave me this inner implant hearing aid that was horrible. And it never worked for me. So I basically finally told my doctor that I was not happy with the situation. So the doctor said, you know what, I'm going to recommend community care for you. So I actually went to an audiologist that basically, when she gave me my new hearing aid, my first crossover one by Starkey, my wife was crying because I could hear my wife on my right side, you know, because I have a crossover hearing aid, because it basically saved my marriage in a way. And, you know, that was a very good primary care. That was a very good community care thing. And, you know, the VA paid for it. And this lady knew exactly what I went through and listened to me. A second time with community care that I experienced very, very closely is with mental health conditions. Okay. They continue to pay for my mental health counseling. I have a really good counselor. I do have to fill out a questionnaire. The VA has come down on mental health, Arlene, and I have to fill out a questionnaire prior to my appointment because the VA requires it. So I have somebody that I can talk to about things because I still have some disabilities that, you know, just with recognition and coping with people and stuff like that, but it's gotten a lot better. Another time that I used community care was actually I had a kidney stone that shut down my body in Phoenix at the airport, and I made it, and I went to the West LA emergency 2 times for them finally to do something. So they had to put a kidney a stent in. I'm sure you know what that is, Tracy, right? You know, it's the wonderful. So I went through that little thing, but I was relieved. But then the doctor said, I will not have time to work on the stone and address it, so I'm going to have to put you in community care. So I was put in community care. They referred me to a urologist. The urologist scheduled the surgery, put me in the hospital, did the whole thing with the stent again, and I went through it with the community care. And I will tell you, living in rurally in LA with dealing with the community care, I've had positive experiences. My negative experiences have been with the VA doctors themselves, especially in those cases. And with community care, I am very thankful they do have that and use it, but I have actually had a community care person removed from the VA who was an audiologist, where I went and had another hearing test and I got a letter from them, and she was half asleep and not paying attention. And I got a letter from the VA like a month later that said, "We're proud to tell you that your hearing condition has improved." And they knocked my disability down 20 points because of that. And I had to get an attorney to represent me to go against the VA on this whole thing. And I had to get 3 different audiologist things. I had Mike Garcia's office, who was the congressman at the time, represent me and go in and do inquiries. So I will tell you, the VA, I compare to Kaiser. You either love it or you hate it. And you really need to know how to navigate the VA and understand it. And that's why I'm hoping new veterans that come into the VA, they get into support groups and they get the knowledge of how to deal with it. And that's my goal, and understand the process and ask for community care when you need to. Even in cases where they tell you got to wait 4 months for an appointment, you ask for community care. They can't say no.
So I have a question to all the veterans on the call first, and Greg, you can chime in as well. When you sign up for the VA, do they give you information, or is there like a veteran service officer, or who do you talk to sign up for community care?
So in my experience, I've gone to the VA, and we're fortunate here. We've got 2 locations we can go. It's been, our care here is pretty outstanding. The challenge is, again, their workload is pretty significant. So the referral we do have through Vermont Veterans Affairs, which falls under the military department, so actually works for the adjutant general. We've got veteran service officers that do the outreach and facilitate for the veteran. But Arlene hit on something, kind of a byproduct is, how do we get the word out to veterans? We're all talking about it. Once somebody leaves the service, I would use as an example, the Vermont Guard is a small example. When they leave, we don't track them. We lose track of them. We don't know where they go. We're not in contact. So short of them following us on some social media platform, we don't really communicate with them. Vermont Veterans Affairs, I'm guessing most states have a Veterans Affairs office under their military department or something like it. They may have a better track, but as an organization, the Guard and probably the military at large, we don't track veterans. We don't communicate with them effectively, so they don't know what to ask for, and they certainly don't know how or with whom to push back if they get told no.
And can I chime in too? Go ahead. Well, Gregory had a point there too, because you know what, JW, I was told by the veteran service officer in Los Angeles, LA County Veteran Service Officer, I have a right to ask for primary care. They can deny our community care, they can deny it, but most of the time you can ask for community care. Like I just requested it for my right knee because they told me I can't see an orthoped. They don't have an appointment until August, September. So I said, I would like community care, please. So I've already been contacted yesterday by a community care location in Lancaster, California. So that's the thing, we have to get out the word, ask for community care, because they will use community care. That's amazingly enough.
So
if you have a referral to a specialist, from the day the doctor puts in the referral, if it's more than 30 days from that day that he puts in that referral, for you to get an appointment with a specialist, you can ask for community care.
Yes, and then they have to, and you know what? I believe the VA of Greater Los Angeles they have a vendor that they use that does all their community care referrals and everything. So once the doctor refers it out in the system, it goes through. Community care, it just needs to be knowledge, you know what I mean? It's standard knowledge. And then some of these veterans like Tracy, I went to somebody to find out the root cause of my kidney stones, and I changed my lifestyle. It was a lifestyle change, but I appreciate hearing that. And I found out what was causing it, you know what I mean? And you know what can cause it, magnesium, or you know, not taking the stuff. So that's just a thing. I'm just complimenting the fact, you know, Arlene, like with mental health, your thing, if you need to drive that home, because you know what, they're going to give you the mental health. They have to pay for it. Mental health with the VA. If you say mental health, you need it with your doctor, they have to refer it.
I have asked more times, like I have, believe me, I am persistent, and they continue to refuse it. And I continue to tell them that I need care. Every single provider, every single psychiatrist I speak to, I ask for mental health outside, because I already saw a provider outside, a psychologist. I already have a relationship with him, and they refuse. And the last time I went for mental health at the VA, they made me have like 6 appointments with different people before they even started to get me to see one person. And I got so tired of telling my story over and over and reliving my traumas over and over again, that I said, look, you're making me worse. I don't want to see anybody. I want to go to community care. They refused. I have spoken to everybody that I can speak to.
Well, the guy that runs LA, the Sepulveda office, he knows me by name because I went straight to their management. And you know what? When you go to a manager with it, because they made a mistake on my glasses, for example. I went and got glasses from them, which don't work anyway. And the glasses, like, I'll give you an example real quick, because I know Tracy wants in, but the example that I give you, I complained. I said, this audiologist saw me for I timed him 4.5 minutes. He said, and he diagnosed a prescription that didn't work. They made it look like I was looking through a Coke bottle. And you know what? When I kept going back and forth with him, then I saw the resident. Okay. And then the resident looked at my glass, you know what I mean? So if I were you, I would go to your VA office and ask who the manager is, because there's a GM there, like a general manager. And once they hear from you, you're going to get taken care of. And you keep sending them messages on My Healthy Vet and sending it to that person, they're going to have to deal with it, because not only that person sees it, but his bosses see it. So it actually goes to like 6 to 8 people, I found out.
Hang on, Arlene. I want to get Tracy in here.
Yeah.
Because as you hear about what the system that the VA has for community care, think about how much better a private system of network with the thing that you're trying to envision. So kind of see if you can tie some of this together.
Yeah, I wanted to ask if the military offers a health savings account like a lot of the private employers do, where they're doing pre-tax, not at all. So Jordan, when you saw your root cause health practitioners to find out the cause, the magnesium related cause of your kidney stone, it was just totally out of pocket.
Yeah, I basically went to Kaiser, and the doctor is like a holistic medicinal doctor, plant-based, Mr. Plant-based diet, because I do see him at the same time. And he actually, you know, he looked at my blood work. It cost me $25 copay. That was it. And he went through and looked at my blood work, and he said, yes, your blood work and the urinalysis, the 24-hour urine tank fill up, you know what I mean? I'm sorry, I don't mean to get so graphic with you guys, but he actually told me that the root causes, you know, the magnesium, you need to take some vitamins and vitamin up and everything and get it. And I was convinced, taking Paxlovid during COVID, I took Paxlovid once. I was convinced that, you know, that was a contributor, because I started reading the warning labels that kidney stones were found in a percentage of people. And the kidney stone was black in color, which was out of the ordinary, because normally they're white,
Right.
and it's the most painful thing I've ever had in my life, and I don't want to remember it, and I never want to go back to it. So I've been watching it.
Wow. Well, it's great that you figured out taking magnesium helps. I think what I understand, I went to a National Health Federation conference and like last year, and there was a whole presentation on how our country is deficient on magnesium. So they were suggesting it for everyone. I just took some this morning.
Why does
And I think,
Costco have 3 aisles?
yeah, and I think we're also short on vitamin D as a rule because we're not getting out in the sun a lot. And that vitamin D was correlated with if you were more short on vitamin D, you had a worse case of COVID than if you had
Yeah.
high levels of vitamin D. So then the whole question is, how come on the news and all over the medical establishment, people weren't offering vitamin D to everybody? I mean, it was insane that we didn't do what we knew would work. But anyway, yeah, I just wanted to address this whole insurance thing because when we're bought into a system or we get a benefit from something or we pay for it, we want to use the people in our network. So it's the same if somebody had Blue Cross Blue Shield or United, they're like, well, I don't want to go to pay $100 for a naturopath because I can just do my copay because I'm already paying for my insurance. So what it effectively does is it keeps you inside what I consider an allopathic monopoly. So I'm starting to view big pharma as an octopus, and it's got its tentacles in everything, in the federal government, in the FDA, in the CDC, in the news media, in the hospitals, in the medical boards, training the medical school staff. We're taught that giving people drugs is the way. But the drugs aren't drugs unless they're synthetic chemicals that are patentable and profitable. And we didn't evolve as a species with these chemicals that are essentially covering up a symptom and then causing another symptom. And I'm probably speaking to the choir here, but the point is that the knowledge about how much sunlight you need and whether you should get the first sunlight, I've been hearing more and more about, getting up at dawn and looking at the sun in the beginning of the day because it's important for our bodies, like John talks a lot about touching dirt, like just all of these natural things is how we evolved, yet it just seems crazy to me. Like just a couple years ago, I just had this quiet thought. What if all of these intense efforts to develop drugs is not the way to health? But
It's
yet
not.
it is the standard. So we're paying twice for it. We're paying for it in our insurance, and then our insurance keeps us in an allopathic system. And then we get the drug, which doesn't improve our health. It covers up the symptom. So maybe down the line, we'll get desperate enough to do a root cause analysis or be determined enough, like Jordan was, to determine what the cause was of his kidney stones. But we are on an unsustainable path of health bankruptcy because the allopathic monopoly and the tentacles of the octopus have got a hold of us, and we've got to shake loose of the octopus and be independently healthy and move into better ways to fund or privately fund our own like true healthcare. There, off my soapbox now.
I liked it. I like it. You're right. I mean, I've taken the same vitamins since that pandemic thing started, and I'll tell you, I don't sit there and catch all these colds and everything because, just some basic stuff: vitamin D, magnesium, and zinc. Those are my go-tos.
There you go. And I would add NAC to that.
There you go.
Precursor to glutathione.
There's a number of good supplements to take that can just for basic overall health. Obviously, you guys touched on magnesium. There's other things like omega-3s, GABA, calcium. There's a number of those things, but I want to give you guys some, because you know me, I'm Mr. Data, so I like to get some stats out there. So when you're talking about chronic disease or preventable disease or preventable conditions, I believe the stat I recently saw was that 80% of chronic disease are directly linked to modifiable lifestyle factors. In other words, you did something in your lifestyle or you're not doing something in your lifestyle that then translates into this disease. Obviously, type 2 diabetes being one of the major ones. So when you talk about what Tracy was talking about with the big pharma or the pharmacological approach, a lot of times if your lifestyle changes your lifestyle changes cause your chronic disease, then a prescription drug is not going to fix the root cause. That's what's so like when you, especially when you talk about the MAHA movement, I think that should be like the driving force of, Make America Healthy Again, is fix your lifestyle. I think, Arlene, if you look back at all the things that we did over the years with all those rides and all those people and how they changed their lifestyle, and that led to better health, less prescription drug use, better sleep, better relationships, better outcomes, it was because we modified or adapted your lifestyle to a more healthier path. What do you think about that?
And not only the physical movement of riding a bike, but the sense of community of being with a group. Even having, when you have your weekly calls, having a group being on the calls brings people together. And that is an enormous help with both the physical and the mental health. And I cannot tell you what an impact you have made, not only on myself, but on my family, on my children. So, and now I'm going to cry.
Well, yeah, JW, I can hear that with the health, because you know what? You see like certain people, like I have a cousin that's really sick right now, and it was years of abuse on their body. You know what I mean? It's like the Big Mac meals, the this, the that, eating the wrong food and doing the wrong things. I mean, by the time you get there, when it starts affecting you, you're either going to grovel or not. I mean, like, look at me. Like when I go to a game, the Dodger dog is a total treat to me. I mean, that's like the treat of the treat, and I have to savor every bite. You know what I mean? And just those things. That's the way it is, and we create our own health. I listen to my doctors and communicate. That's the other thing I was going to bring up about the VA is you have My Healthy Vet. And when you email your doctor through My Healthy Vet, your doctor's going to respond and your doctor's going to talk to you. So you can interact. My doctor has a caseload of 750 people, I found out, she told me, on her roll. But you know what? When I email her through My Healthy Vet, I get a response. And when I email anybody through My Healthy Vet, all the people, specialists, foot doctors, anything that I deal with the VA, I get a response. So that's another thing that, hopefully I tell veterans, go on My Healthy Vet and actually send them the message. You know what I mean?
Yeah. So Greg, as the Adjutant General, you were involved in that task force that dealt with sexual assault, domestic violence, substance abuse, and suicide prevention. And so most of those data sets in most National Guard units are siloed. But did you ever think about what would happen if you could understand how, let's say, tobacco or alcohol or recreational drugs or even prescription drugs had an effect that was linked to let's say, suicide ideation or anger or domestic violence or some type of trauma?
Well, John, that's one of the most frustrating things. I think we flirted with it. I think we danced around it. I think every state kind of does its own thing. You do, if you're looking at organizational culture and climate, you'd use the DEOC survey. If you're looking for unit risk, what risk are you dealing with? Again, it's a once a year thing. It's voluntary. Not everybody takes it. But unit risk inventory gives you an indicator. But at the back end of it, there's no so what. Who's collecting all of that data and providing realistic innovation and solutions that we can implement in the field? And oh, by the way, who's listening to the field? Who's taking that and synthesizing what we're telling them instead of giving us yet another canned, hey, do this and it'll work? Well, that's not how this goes. We're telling you what we need, and we're not getting a whole lot of engagement. Again, they're doing great work, but I just don't know that they're doing what you're talking about. I don't think we're synthesizing information and actually coming up with the right solutions, John.
Sounds like we need a real-time technology solution for behavioral health risk.
Oh, I'll guarantee it. I mean, and you go down the rabbit hole with that, you've got to talk about, like we said, having enough providers, and having a system that's efficient and streamlined and simple enough to use, like, the community-based options that are out there. And again, getting rid of the stigma that's still out there. I mean, I certainly tell my story, and as a senior officer in the Guard, I've had folks come forward and say, hey, listen, I listened to what you said and I went and got help, and you were absolutely right. That's validating, but those are one-offs. But getting rid of that stigma, it's still there. And we did that to ourselves, in my mind. If somebody goes and sees a military provider,
Hello?
We lost them. Yep.
yeah, how about now?
Well, no, I knew what you were about to say. You were going to say if someone went to go see a military provider, automatically you got the scarlet letter.
That's correct. Yep. Now you can go to the vet center, but talk therapy doesn't work for everybody. And sometimes you're better off doing what Tracy suggests and finding some other solutions that maybe the military, TRICARE, or the system hasn't yet embraced.
Well, no, I mean, I like we were talking about the other day, I think we need to change the way we talk about it completely. I think, in the military, they train you to shoot. They train you for all kinds of things. So why not have resilience training where everybody can go and get resilience training, resilience training and education? That's my way of speaking about it. Go ahead, Tracy. You're on mute.
Oops. All right, here we go. I have a free idea for resilience. For years, I've known about and been a part of a peer-led cognitive behavioral stress management support group. It's called Recovery International, and it was started in the 30s by a psychiatrist in Chicago. And it's the first kind of cognitive behavioral therapy, and it's free. So if you go to recoveryinternational.org, because they have spread now to countries like Canada and Ireland and Mexico, they have calls. They have like Zoom calls, and the way that they structure the calls are, so it's for anyone who's dealing with anger or depression, or anything where really the root cause is judgment that either I am wrong or the judgment that someone else is wrong. They shouldn't have, or I shouldn't have. And so what we do on these calls, and this is just to let veterans be aware of it, is we start with a reading, we talk about the reading, and then we share successful examples from our life about, it's a 4-step example of it was Tuesday afternoon, this happened, this happened, this happened. And that's when I started to work myself up. That's step one. And then step two is, how did I escalate my own working up process? They shouldn't have done that. I wish I hadn't have done that. They're evil. This is bad. Like it's catastrophizing, or it's like escalating the stress process. And then step three is a series of phrases like, I'm not wrong, I'm average. He's not wrong, I'm average. This is a triviality compared to my mental health. Humor's my friend, temper's my enemy. Plan, decide, and act. A firm decision steadies you. You can tell I've been doing this for like 25 years. Like they just rattle off. There's like 120 of these phrases, and they're useful to calm one down and to take the emergency out of the situation. And then step four is, before I had this training, I would have replied to the email and told him off, like it's because this program is really about self-control and taking a cooling off period and not letting anger and fear get the worst of us. But I just wanted to share that. Again, it's recoveryinternational.org. They used to have more in-person meetings before the COVID policies, not COVID, but the COVID policies discouraged us from gathering. And then people paid a voluntary fee at the end of the meeting. But now that they're on Zoom, you can go to these meetings for free or give a donation if you want. But I think it's a good resource for people to know about, JW.
No, I'll check it out.
Yeah.
I mean, I think you touched on a couple of things: anger, definitely judgment. I mean, we've always tried in our program, and Jordan, you can chime in on this because you're part of it on a daily basis. But we run a no judgment zone pretty much. We don't let people talk about politics. We don't care if you like Trump or don't like Trump, don't like Trump. We don't care. We care about everybody being the best self they can. And I know one of the things that we learned, and Arlene, we lost Arlene, so I don't know if she's coming back, but one of the things we learned on our bike rides is riding bikes helps people deal with their anger. And people get anger for a lot of different reasons. Sometimes they just can't, their brain isn't equipped any longer to process certain things, and it creates frustration, and then that frustration creates anger. And having doing something physical, especially in a social environment where you're working together with people, sort of helps mitigate that. So I don't know, Jordan, if you want to speak on that at all.
Well, I could just say that your group has done something for me. It's like there's 200. I was just looking on it, and there's over 200. There's 245 members on there, and by far, if I want to like take a picture of something or just brag about something, like the Galaxy game, for example, I have a whole group of people that will respond to it, and that's the beauty of the Life Aid SOAR. You know what I mean? The group on. It's on, the WhatsApp. I actually met you guys at a Galaxy game when I scanned
I know,
the QR
I remember.
code. And, and you know what? It kind of gives you something to look forward to because you're watching the app on a day there's a Dodger game. It's just one of the little fringes in there. I've actually gave away my Galaxy tickets on there, and I've met people on the group, and I became friends with somebody there where we text back and forth. So it's kind of cool. But it's something that's there. I think it's really cool because what I think about it is there's a lot of lonely veterans out there. I know there are, and that don't have a social circle because they can't. But some of them, I'm hoping, are on that group where they know they can blurt out something to talk to something. You know what I mean? They can talk through that app. That's what's neat. And I do ride my bike, but you're too far for me to ride, and you'll probably I'm like on training wheels compared to your physical fitness, with some of you guys, but I could try to keep up one day. You know what I mean?
Well, it's not about how fast you go, it's just about participating. And I
Exactly.
mean, that one group that you're part of is just one of the many groups. Arlene's involved in another group that I have that's people. So I mean, it definitely connection. Like I always say, and Tracy kind of said it before, it's like I say, eat real food, touch dirt, and build your community. Like those are three things you can do, you control. you're in charge of your life there. You do those three things, and you may not be all the way there, but you're definitely most of the way there. Just that,
Well,
just those things.
I like standing on grass in my bare feet in my front yard. Okay. Because you know what? You're connected with Mother Earth there. You know what I mean? It's sometimes in the morning, you just go out there with your cup of coffee in hand and just take it in and then go kick butt during the day. You know, you have to.
No, it's really cool. And I think we just lost Greg. I was just going to throw it to Greg because he lives in God's country there in Vermont. I mean, it's unbelievable how beautiful it is where he's at.
I love Vermont. I've been there. We went and drove through there on a trip, and it was amazing.
Yeah, we used to when I was racing, there used to be a stage race in Killington, Vermont every Labor Day weekend, and so that was like one of the last races of the year, last big races of the year was there in Vermont, and I always look forward to. It was a hard race. It wasn't really good for me, but too many mountains, but it's quite something.
Well, you know what, JW, one thing I will close with, my thing is my wife and I take a trip every year between Christmas and New Year's. Okay. And we do a road trip. This last Christmas, we drove to New Orleans. Okay. And everybody said, why didn't you fly? Well, guess what? We got to talk both ways going through there and driving through Texas. We had one argument, and that was when we saw a Tim Hortons coffee actually in Houston, Texas. And I told her, I'm not sharing with you. And she snapped back, said, I'm not sharing with you either, because she loves Tim Hortons. And that was it. That was the only argument we had the whole time. And we've driven different places, and we're still working on where we're going to drive to next this year. And you know what? Get back in your car and do a road trip. Stop flying, because see what's there. That's my suggestion to everybody.
Can I give you a suggestion?
Yeah.
Drive to Glacier National Park in Montana. So leave from LA and drive up, so you can drive through Vegas, and then you can go and you could hit on your way to Glacier on that drive. You can hit like 6 or 7 national parks in that corridor between Vegas and Glacier. You can go see Arches, Red Rocks. You could see Yellowstone. You can see Grand Tetons. Like, do yourself a favor and do that drive, and go up to via Yellowstone. You won't regret it.
Well, and I'm hoping we can develop a way to somehow get a group together and get something called Navigating the VA. I'm hoping that can happen one day, because if it happens,
I'm working on it. I
mean, Navigating the VA. I'm actually going to reach out to a couple of retired customers that I sold to back in the day that both retired from the VA, and they live in Palm Springs. And one of them was a VA rater. They actually both used to rate people for disability, and I would love to get them in here. And I'm actually going to send them a message, maybe to hook them up with you. So maybe we can get a Q&A session going with these people.
I'm telling you, I have a woman out of Savannah, Georgia. I met her at a suicide prevention conference. At the time, she worked for the VA, and she was in benefits and appeals. And I sat down with her, and I said, you and I are about to become great friends. And this was about, I think, 5 years ago. And I talked to her pretty much every week, because I refer vets to her, and she's able to help them with disability ratings and benefits and appeals. And over Christmas, we got this Vietnam vet who had been like, I think 50%, 30%, something like that. We got him up to 90%. And his wife called me on the day after Christmas. It was one of the best phone calls I've ever gotten in my life, about how much this person had totally changed their life, totally changed everything. So they were finally able to get him the care that he needed. And he's, in his 80s, so he doesn't have much time left. But I mean, there's two things I really want to do. One is we need a network of providers and clinicians, or trusted sources, the thing that Tracy's working on. We need that network, and then we need to be able to plug people into the network in a fast, easy, trusted way. And that's kind of what I'm working on right now. So it could be for veterans, but it could also be for just regular people too. Like, because the providers that Tracy's going to reach out to, or that Tracy's trying to build with her network, those providers can become VA community care providers as well, right? They just have to go through the process and apply. So there's a way to do that that can benefit the American people, I would say, and that's one of my big goals right now.
Oh, and also I will tell you in finality, I have a friend that owed like 2,500 to the VA in bills, and he was underwater. And I said, no, we can go online. We went online and listed all of his expenses in the questionnaire on his bill on the VA website, where his billing was, JW. And his expenses outdid what he could owe. And he got a response back from them and said, your debt has been wiped clean because of his financial situation. So if there's people that owe money and you ever hear that and they get depressed over it, make sure you let them know to go in and fill out a financial waiver or a payback agreement, because that's all available on the website. And that's why, the VA knows how to get you into the doctor and tell you when your appointment is, but they're not going to tell you how to navigate them. They're not. They never will. It's, it's the web.
Well, it's I can't get too political because I need their help for what I'm trying to do. But, customer service is important in any business, and understanding customer service and how to provide customer service. And, I always say, you got to make sure you're listening to the people you're trying to help. And I think that goes across not just veterans. I think it goes across other groups as well. I mean, my big question I ask in all these meetings is, are we listening to the people we're trying to help? And I know in the suicide space, and unfortunately we lost Greg, we are not listening to the people we're trying to help.
Well, hopefully we can change all this someday. And this was fun. This was a fun podcast, the first one I've been in a few years.
Well, we like to keep it fun, and I really appreciate you jumping on short notice, you and Arlene. It's good for Tracy because I don't think she gets to talk to too many veterans. So it's good for her to see kind of what's out there, and I'll throw it to you, Tracy, for any final thoughts. You're on mute.
Sorry, I would like to nominate Jordan for the role of Veterans Care Navigator. And it seems like it would be a great service. I mean, people getting their bills wiped out, people finding out how to access community care. There's in the other spaces, they have these people called care navigators, and that's in the business model that I'm building. It is kind of a care navigator model, and people need that. So I would, if Jordan has any extra time on his hands or is looking for a second career, and also Arlene, she's I would recommend Arlene as well. She's persistent. So, advocates within the system, there's a need for that.
Yeah, I believe that what we need, again, it's a multi-tiered approach, right? So you need a center where people can go and get the kind of intensive innovation care, the hyperbarics and the infrareds and all the different, holistic health approach, lifestyle approach, medicine. You need that place, but then you need things that are in between that, because not everyone needs to go to the center. Some things you can take care of where you live. And so you need like a customer service, I'll call it customer service, but like benefits navigator or health navigator or whatever you want to call it, navigator. You need a 24/7 or at least, sun up to sundown type of customer service line where people can call in and say, I need help with this. Now, there is a network of veteran service officers that exist that are generally affiliated with your county government. Every state has a state director, but veterans don't know to call that, or veterans don't know like what's available to them. and they call the VA, or they even call the VA crisis veteran line. They call 9881, and the crisis line doesn't know what to do with that either. So there is a huge gap that exists, and you could triage that. And one of the ways that I'm looking at it is, as I mentioned to you, is through my app. Like if people are on the app and you're using the app and you get your score, you can use AI to get connected or ask questions and post questions about, hey, how do I do this, or what VA benefits, or what health plans, or health savings accounts, or whatever it is, because it could be both civilian and for veterans.
That sounds really helpful. Yeah, like putting all the knowledge, collecting all the knowledge, and then bounding it within and having AI go and be able to access it so people can ask questions would really cut down on costs. And you'd be able to have a great system that would be 24/7 accessible. And then for the harder cases, you involve a human.
Yeah, I mean, I believe you can have the AI, but you can also have something where people hit the button and they get a live person, and you get someone like Arlene or Jordan or the woman that I work with in Savannah, Georgia, or whatever it is, that where you get a live human being that is if you're a veteran, you get someone who is a veteran who has some experience in navigating the system, and they can flatten out the learning curve. Because as you get back to what we talked about before with anger and all those things, I mean, can you imagine the frustration? I mean, you can hear it in the voice of both Jordan and Arlene, the frustration and anger and fear and everything that they go through, and you wonder why there's, we have the issues with resilience that we have.
Exactly.
Any final thoughts, Arlene? You're on mute, just so you know.
Yeah, I know. Yeah, we need advocates that really understand, because the patient advocates that the VA have are there not to advocate for the veterans, but to advocate for the VA. And they cover up a lot of things. And that is not good. We need advocates that are going to be patient advocates, that are going to understand the complexity of the medical issues the veterans have and how it impacts their family. And again, programs like you've established, John, with the sense of community and just getting us together, we've networked between each other certain issues that we've had. So we need real advocates. So if Tracy, if you're looking for any help.
Well, she was talking about you while you were off, so don't worry.
I would love to help, because I believe in holistic medicine. I believe in just being an advocate for our patients. There is a combination of both traditional medicine, but we need to look, like you said, on the root cause.
Right.
So.
Well, I think that's great. And yes, I'd like to be put in touch with you, JW. And one thing that I'll just point out, you made the observation about patient advocates at the VA advocating for the VA. Probably it's because the VA is paying their salary.
Correct.
So we tend to be loyal to the people who are paying us, because everybody needs money, everyone needs to eat. So what if the veterans across the country could pool their money together, and the veterans themselves pay for some patient advocates, some veterans navigators, care navigators within community care and the other programs? It would be great if veterans could pool their money and fund that.
Just wait.
Yeah, I
It's
think,
coming.
yeah, but even, hey, even have, even if we can get the government to pay for those advocates, but that it be separate from the hospital. Does that make sense? And that those advocates have, so if you're going to have a patient advocate that works in a hospital, they need to have some medical background so they can fight the issues that the
Well,
veteran
you don't necessarily need a medical background, but you do need experience. If you're advocating for something, you should have some experience in what you're advocating for, right? So you're actually helpful.
Well, I'm going to give you a good example. I had issues with the Women's Center, and I asked for a male provider. I had this issue for 2 years. I was told that I could not have a male provider because I'm a woman, and that male providers cannot take care of women, and they have to be women trained. When I spoke to the advocate about this, he said that was the policy. I said, show me the policy. He goes, I don't have it. Well, guess what? Arlene Augusto found the policy. And in the policy,
I'm not surprised.
And in the policy, it states that if the veteran asks for a male provider, if the VA cannot provide that, then they have to send me to community care. And
Yeah.
it took me making, I don't know how many White House complaints and a congressional complaint and an IG complaint for them to give me a male provider. So that's all I have to say.
Well, no, it's great. I mean, I really appreciate everybody coming on today. It was a great discussion. More to follow. And as always, hope springs eternal.